So I really like neurologic cases, is one of my favorite ones to treat because a lot of them, especially if it's an acute injury and we get our hands on them pretty quickly, there can be a dog that's paralyzed. Their vet thought there was no other option. Or maybe the vet said your dog needs surgery, but we can't afford surgery or we're just not going down that path. So there's a lot of cases where that I get where the vet said this dog really needs surgery or he'll never walk again, and we make them walk, and very commonly we
That's
can
gotta be
do
so
that.
rewarding.
It's so rewarding, and that's why I love those cases. Now, there are some that do need surgery, absolutely, but there's a lot of them. I think there's a misconception, and with my training as well, where you're kinda like, "Okay, we give them the medicine or we do surgery," but there was no in between, and I have been surprised when I first started by my results that, gosh, this works so well for neurologic disease. So that's probably my favorite.
Yeah.
Arthritis, it is gonna be more of a maintenance thing. Those changes are there. Those
Mhm.
bones, we are not gonna remodel those bones with acupuncture, but we can decrease the pain and inflammation, release endorphins, serotonin, mesenchymal stem cells, and we can really help that pet. But if it's a 12-year-old dog with horrible arthritis, it is gonna be a maintenance thing
Mhm.
ideally where we're seeing them, and some are much less frequent with their maintenance, and we still get benefits. Some come quarterly, and that's all they can do, but we're still seeing benefits,
Right.
especially if we add in some herbals and supplements
Yeah.
too.
Well, I guess following up on that, do you see any, like, younger dogs? I know with horses, you're more on, like, horses that do shows and sports and stuff like
Yeah,
that,
a
but
lot
when
of
it comes to
performance.
dogs, do you just get oldies, or do you get, like, some young
Yeah,
dogs that are, like, trying to do, like, preventative care or
yeah,
just keep them in great shape kinda care or whatever?
good question. So we get everything. I would say more old than young, but we certainly get those younger dogs. We get behavior cases. Sometimes our herbal, like those dogs maybe that go to training and it's like, gosh, we're just struggling. This dog has so much energy. Maybe the owner can't exercise the dog as much as they want. So training is very, we recommend you in training all the time because a lot of times the dog needs exercise, it needs discipline, you need training to learn how to work
Work
with
with
your
the dog,
dog.
right, yeah.
So
Yep.
that is a huge component with behavior. I'm almost always recommending training, but some dogs have aggression or other issues, that with training, we haven't totally been able to work out despite the trainer's, ability and everything going right. It's just some issues still persist. So the acupuncture can balance some of that aggression.
Wow.
Some dogs are not gonna be good. I mean, if they're just horribly aggressive, just like for you, you probably come across that are just difficult
Well, we
candidates.
literally don't train dogs that bite people or dogs, it's
Yeah.
just not our thing, it's
So
like
we work with some, but some we're gonna say it's not a good candidate for
cane
this.
corso, aggressive, can't get a muzzle on it. You're like, "I'm
Yeah,
not
I mean,
doing it.
there's some limitations for
I'm just not
sure.
doing it."
But we get performance, so we get field trial dogs.
So, and those just like to keep the motor high RPMs, where they're just moving and grooving kinda
Yeah,
thing.
I mean, they're very expensive dogs. They're performing, and when we get show dogs, we get like the cattle dogs I was telling you
Yeah, yeah.
about. Some cattle farmers that have really high performing, high quality dogs. They get kicked by cows a lot, so we get that kind of younger patient population. Anxiety, big one. We do a lot with anxiety and can get good
Acupuncture can
results
help
with that.
anxiety.
Yeah, absolutely. So we get a lot of younger dogs with
Wow,
anxiety
really?
as well. Um, and so, yeah, there's a lot and some people just want us to be their regular vet. We're not full service, but we can do a lot. So we'll see their dogs, regularly for preventive care and offer as much as we can, and then they have a backup plan. So we do a lot of just general things as well.
Well, I guess it definitely you help a lot more people than I would have realized. Because honestly and I might have asked you that before and just forgot, but I really just thought it was like old dogs like my dog was. So,
Yeah, no,
no,
yeah,
it's not
there's a
though. You do a lot of
variety.
stuff,
Absolutely.
outside of just that. Are the needles that you guys use for dogs the same as you would use for a human or different?
They are. Now, I get most of mine from a specific veterinary distributor just because I order my herbs from them and it's just a simplicity thing. And I like their needles. But there are certain needles sometimes that I prefer that are human grade needles. And but they are essentially the same. It's just
Just
yeah, just the manufacturer. Some are veterinary specific, but they're very much interchangeable. Just the size and gauge is essentially what we're looking at.
that'd be like length and then how big the needle actually is and stuff like that.
Exactly. So
Well, they
different
were always pretty
indications.
tiny. I mean, with Mia, like, they were
Yeah.
always, like I mean, super tiny,
Yeah, a horse may
needles.
get a 3-inch, much
Yeah.
heavier gauge needle, but for Mia, we
Yeah,
did
thank you.
1/2 inch to 1 inch and a smaller gauge.
My follow-up was, "Does it hurt?"
Oh,
Yeah,
yeah.
does it hurt,
That's
the
it.
dog?
We get asked that all the time. So, a lot of times, no. I mean, and in just my personal experience getting acupuncture myself, sometimes she puts a needle in, I don't even feel it go in. I just know, like maybe she pinches my shoulder, so I know she's there,
Right.
but I don't feel the needle. Now, when she places them where I in my SI region where I have a lot of back issues, the needles in that region do tend to hurt a little bit, not bad, but I feel those a little bit more, and it's not terrible, but it's just because there's so much inflammation, and, myofascial pain and things like that going on in that region. So those are a little more sensitive for me. But as soon as that needle goes in, I don't feel it feels good. You get a release, you get the endorphins, you're relaxed, and actually it feels good being in there. So most dogs are very compliant. There are some points lower down on the feet that are gonna be I mean, your hands have more nerve endings, so those
Mhm.
are a little more sensitive, so some patients don't like those, some do fi we did those on Mia.
Those
Those
are
are
the only
really
ones that she
strong,
would ever, like,
powerful
raise her,
point.
like, her teeth at you at,
Yeah,
because I was gonna say firsthand experience, like, my dog, like, whenever you were popping needles in her, like, she was totally fine with it. The only
yeah,
time she ever really had issues was, like, the one that was, like, right on the knuckle, really.
yeah,
Like,
she
those
didn't
ones
love that.
yeah, and, I mean, fortunately, she never, like, snapped or anything. She would just kinda raise her teeth a little bit, or show her teeth a little bit, but other than that, like,
And we always listen to the patient too. Like if this is gonna be perceived as super like if they're just a little, I don't love it, but they're compliant, they're still happy to see us, we may go for it because some of those points on the feet are really, really powerful. And I really want this to, we're doing everything,
right,
so it's pros and cons of each. But some dogs don't need those points. A lot of dogs don't care. So
yeah.
we just kind of look at their response and determine, okay, there's over 360 points on these dogs. We have more to choose from. So we don't always have to choose a specific one that we initially
Yeah.
set out to do. Yeah.
Yeah, that makes sense. Yeah, I would say too, I mean, it's kinda interesting because once again, firsthand experience, like, you would think, like, the dog would be very averse to it, because like, Mia
Yeah.
absolutely hated the vet's office, but, like,
Yeah.
got so excited when we pulled up to y'all's property every time,
Yeah.
because like, your property is on your farm, and so, every time we turn in the driveway, she'd start going, "Brr," barking and getting excited and stuff, and then whenever she got in there, she was happy to see you, happy to see your colleague. She'd, like, almost try to jump on the table, she was just so happy to be there, and so it
Yeah.
was really interesting because you would think she would be very averse to it and, like, not like it because she's getting stuck with 30, 50 needles, however many it was, and it's like, no, she actually really liked it quite a bit, so
Yeah.
just
And most
interesting.
do. I mean, really, I will say, and some at the first visit, they don't trust it. They don't know what's going on. But almost every single patient we see gets better with every treatment. And we hear that all the time. They get excited. They know they're coming. I mean, one thing, Megan is amazing and she makes homemade treats, that we offer. I feel like Mia, we didn't really give her, you just
She
kind of
just
held her.
didn't
She
actually want
she didn't
treats.
really want treats. She just wanted your love. And so some dogs are like that, and that's fine. But some come for the food,
Yeah,
in
that's
their
funny.
mind. And it's just relax. You kind of feel like you're
Yeah,
coming to someone's house. We have regular furniture. We just try to keep it like, hey, you're coming over to the house. We're gonna love
yeah,
on you, and it's gonna be a good
yeah,
experience.
it
Yeah.
is really nice. What else was I gonna say? Oh, she did hate going to Doctor Parker's office basically until the day she died. She really did hate that. I think it was because like, it was a regular vet though, and, like, whenever Doctor Parker would walk in the room, she'd walk up to him and be like, "Hello," and then walk back to me, but it was a regular vet in the sense that it, like, had all the smells and the noises and the stuff you were
Yeah.
talking about earlier in the show
Mhm.
where it's like, oh,
Well,
and
there's a
so,
lot of
anyways.
things happening in a regular vet clinic. I mean, there's dogs unfortunately dying. There's dogs in distress, and I mean, as their noses are very strong. I mean, they can smell and sense that. So
I mean,
I think that's why a lot of them
she
get that
hated it so bad.
anxiety.
It's so
Yeah,
bad,
and
so
some don't. Every dog's different, but some do get that vet clinic anxiety, that white coat syndrome.